Hi, everyone. My name is Pranav Tadikonda. I'm a summer intern through the Biomedical Innovation Workstream. I'm a current rising junior at the University of Pennsylvania, where I'm studying biology and health and societies with a concentration in healthcare markets and finance. Today, I'll be presenting to you my research work over these 10 weeks. I did a lot of work in the regulatory policy space, specifically working with the FDA, and my project is opportunities for improvements in REMS system implementations. So as I go throughout my course, explain what REMS is, explain what this project entailed. It's a very regulatory project. The purpose of it was to really improve workflows in healthcare settings, benefit relevant stakeholders, which I'll go into soon, and ultimately get drugs delivered safely to patients. So what exactly is REMS? So REMS stands for Risk Evaluation and Mitigation Strategy. And what that specifically is a program mandated by the FDA. It's when it requires certain drugs with certain safety issues to have a safety program. It's meant to ensure that the benefits outweigh the risks, because essentially that's what a drug is for, right? While there may be potentially harmful side effects, if the drug benefits the patient for that specific therapeutic area, it should definitely be delivered to the patient. And the stakeholders involved in REMS include the providers, the ones who actually prescribe the medication, the pharmacists who dispense the medication, and ultimately to the patients who receive and use the medication. So it's kind of like this map that shows it starts with the diagnosis by the provider, allowing the provider to determine that that medication is necessary, then going to the pharmacist who determines that who gets a prescription and determines that the patient needs this medication, and ultimately the patient who actually needs the medication who's prescribed it to treat their condition. So it's really important that throughout the process of improving REMS, which I'll go into, each stakeholder is equally considered, and each stakeholder's opinions and workflows are equally considered. So a REMS was essentially established to cover the 60 plus drugs currently, and to ensure that patients can get access to these therapies that could benefit their quality of life or even save their life when these medications may otherwise be too dangerous without a REMS program. So with the REMS, the FDA, the provider, the dispenser, the pharmacist, they all ensure that the patient is taking this drug in as safe way as possible, hence the safest form of drug delivery to the patient. And it's throughout the whole process. As soon as the prescriber determines that this medication is necessary, the safety protocol is in place. So it's a complex process of ensuring through every step of the way that as soon as the patient gets the medication, that patient is getting the medication with every safety measure taken possible. One very common example is isotretinoin. A lot of people take isotretinoin to treat very severe forms of acne. So when patients get prescribed isotretinoin, it's really effective to treat their acne. However, it's very toxic to the embryo. As a result, it's really important that the REMS program for isotretinoin includes counseling to the patient to use certain contraceptive choices if the patient is sexually active, as well as ensuring that drug tests are routinely performed so that in case the patient is pregnant, it does not harm the embryo. So throughout the whole process, it allows that the patient can take this necessary medication to treat their acne, but at the same time, it ensures that they're keeping all safety measures in check, and not causing any harm to their own bodies. So there are, of course, burdens associated with REMS because it's a process that involves many stakeholders, and there are inefficiencies that rise as a result of that. Some key burdens that I found through my literature research, as well as in my interactions with FDA members during meetings and with my mentor, there's a lot of difficulty understanding and accessing requirements and navigating websites. So a lot of REMS programs have websites that can allow the user to basically go through all the safety protocols, but there's a big education gap. They're not even aware of all the requirements that are necessary, causing them to oftentimes peruse or look over these requirements and also be demotivated to prescribe. And that also goes to the training and education process. Even if there might even be a training and education process, oftentimes it can be very labor-oriented, very manual, and time-consuming. That can lead to lower rates of prescribing, because if you're a provider and you have to go through all these steps, sometimes you might be demotivated to prescribe a certain drug to a patient, when instead you can prescribe a different drug, or altogether find alternative forms of treatment. What this ultimately causes is an inequity to the patients, because if the patient wants access to this drug, it could be hard just because of a REMS program. There's also lack of centralization. Providers get a broad diversity of patients every day. Pharmacists get a broad diversity of patients every day that require different drugs. But with so many REMS programs, there should be a way to standardize and find like a tool to standardize all these REMS programs. But there's no centralized way of doing so right now. So it's intensely hard for these relevant stakeholders, most notably prescribers and pharmacists, to be able to access all the different REMS programs. So some solutions that I found through my research, a lot of experts actually have pretty good insight about how to alleviate burdens for these pharmacists and physicians. Specifically, the American Pharmacists Association recommends using existing technologies already in place, as opposed to innovating something new using already what we have. A notable example is the EHR systems. One proposed solution was to use these electronic health records to prompt providers or pharmacists to go through safety protocols and when a REMS is required. For example, if you are prescribing isotretinoin, you would look to the electronic health record system, and you get prompted as soon as you add that to the system that here you need to prescribe isotretinoin, and you need to go through the REMS process. Also, you can streamline communication to stakeholders for awareness on REMS requirements. So having some sort of communication platform where all the REMS stakeholders together can easily access relevant tools, that's another important tool. And finally, implementation of a mobile app or online portal. Technology is clearly important through this process, because a lot of REMS is already through technology. So having a mobile app that is the most easily accessible and easily understood form of communication and technology, or online portal, it can just centralize everything together. And these are all potential recommendations that have been recommended by experts. But there is one main solution that's actually being focused on by the FDA and MITRE. And here it is, the REMS prototype. So the REMS integration prototype is a project that's been jointly worked on by the FDA and MITRE. There are many features of this prototype that allows all relevant stakeholders, from the provider to the pharmacist to ultimately the patient, to make the whole process really easy. So the first feature is the coverage requirements discovery. You get information from EHR and sends the user links to necessary documentation. So if a patient needs a specific drug, let's say they need Abecma, right, which is a drug under the REMS. The prescriber is allowed to, with the click of a button, get info from the electronic health record, which sends the prescriber all the necessary documentation for them to complete in order for them to be certified to prescribe this drug. And not only that, there's even a document templates and rules feature, which once this documentation is sent to the prescriber or to the pharmacist, it actually assists them in completing the documentation, so you can minimize error and maximize efficiency. So even once they get accessibility and have more streamlined way of getting the documents, this prototype also ensures that the documents are actually filled out correctly. So it's really trying to make the process much more efficient and way more user-friendly. And another important feature is the continuous education service. So like I mentioned before, one big feature of the REMS burdens was the fact that there's so much extensive education and training, which causes many stakeholders to be demotivated from prescribing or dispensing. But this standardizes the entire process and assists users to go through all the education requirements. So it's through one database, and it allows much more accessibility. Another final feature of the prototype is the pharmacy information system. And this is a specific feature just for the pharmacist stakeholders. The pharmacists are the ones who ultimately dispense the medication to give it to the patient. and physically hand the patient the actual medication. So it allows pharmacists to track REMS throughout the entire process and see the progress of this REMS and to verify completion of the requirements prior to dispensing. So right when the patient is there, ready to pick up the medication, the pharmacist can ensure that before they dispense it, that all the REMS is completed and it's ready to give to the patient. So that all makes sense verbally, but it would make even more sense through a map. So here's a very simplified version of exactly how the prototype would work. Like I mentioned before, it would start at the EHR and it would prompt the user, for example, the prescriber, all the necessary documentations. That's the CRD. Then afterwards, decide if we should launch the document templates and rules once the documentation is accessed and given to the relevant user. So after the document templates and rules are used and the user is able to complete all the documentation correctly, all the filled out documentation is sent to the pharmacy information system. That's where the pharmacist who's dispensing the medication gets access to the REMS, can access the progress throughout, and can certify that, oh, the REMS has been completed for this medication. I'm good to go. I can dispense this medication. It also gets sent to the REMS administrative system. This is the do-all, be-all. It's where the ultimate, the final destination. So it ensures it's like a signal that the entire REMS process has been completed. So this entire, starting from the EHR all the way ultimately to the REMS administrative system, it's a very streamlined process that maximizes user efficiency and user accessibility. So it's a big step forward towards helping physicians, pharmacists, patients, and any other relevant stakeholder throughout the whole process of ultimately getting these really important therapies that have been researched on, approved by the FDA, and ultimately commercialized. So why is this important? If I haven't incessantly said it before, the reason why it's really important is because it's relevant to Duke-Margolis specifically, because Duke-Margolis is working with the FDA to ensure that this prototype is actually reflective of stakeholders' concerns. One big issue that could potentially arise that a lot of research points to is the fact that, we have this REMS prototype, but how can we ensure compliance? How can we ensure buy-in? With low buy-in cause low level of compliance. So how can we maximize buy-in? So the Duke-Margolis Center for Health Policy is working with FDA and MITRE, who are developing the prototype, to plan a meeting in October of 2022. It's a stakeholder meeting. It's a workshop, actually, that brings patients, providers, and pharmacists to discuss the experiences they had with REMS and what they would like to see in the prototype. It allows these relevant stakeholders and important stories to be heard so that the FDA and MITRE can take that back and use it to maximize their prototype and get as good of a prototype as possible. And it also makes sure that these stakeholders who might be using the prototype in the future know exactly what's coming, what they might need to prepare for, what they might be what obstacles they might be facing, things such as that. So this stakeholder meeting is a really important transition to ensure that there actually is compliance of REMS as a result of this prototype. So there are efforts being done not just to make things more accessible to the stakeholders, but to make sure that the stakeholders actually use it so that they can benefit from it. So that's my project from this summer. I learned a lot about regulatory policy through this process. Prior to joining Duke-Margolis, I really had no idea about what regulatory policy even is, and I had a very elementary understanding of health policy in general. So I'm really grateful to have gone outside of my comfort zone and explored this different side of health policy. I deeply thank Duray Kim, who's my mentor, for his continued guidance throughout this entire process and always willing to help me. He's countlessly explained all the different components of REMS, what the FDA is doing, what MITRE's doing, a lot of jargon, a lot of terms, but I've learned a lot through the process. Additionally, I'd like to thank Thomas Rose for his guidance on this topic. He's one of the leaders of this current REMS initiative that the Duke-Margolis Center for Health Policy is working with FDA and MITRE on. So he's really been guiding me through the process of writing my deliverable, creating this presentation, and ultimately going through the whole process of this project. So I really thank those two, and in general, the Duke-Margolis Center for Health Policy for this amazing opportunity for me to learn about a completely new side and important side of healthcare policy that I hope to continue looking into and using the skills I gained as I continue through my educational and professional pursuits. Thank you all so much for listening, and I hope you learned one or two things about REMS.